Now the next topic is optic atrophy. The optic atrophy cannot be reversed, there's no treatment, and it's a permanent visual loss. Unilateral lesions are anterior to the optic chiasma. Most common cause of optic atrophy is a vascular cause, anterior ischemic optic neuropathy. So the optic atrophy may be primary or a secondary optic atrophy, or it may be anterograde or retrograde, or it may be glaucomatous optic atrophy is a little different. So we'll discuss that one too. So this is the primary optic atrophy here. You see the chalky white optic cup, and this is the clear margins, very little optic cupping, and the blood vessels are normal. So this is the primary optic atrophy. Compare it with the secondary optic atrophy. This is the second, as seen in papilledema. The discolored optic disc margins are not clear. There are hemorrhages, and it's raised above the surface. So all the features of papilledema we discussed in that. Compare this primary optic atrophy that occur due to optic neuritis and anterior ischemic optic neuropathy. And this is the papilledema. Causes of secondary optic neuritis, we saw that causes tumor, also vascular causes, and papilledema. Whereas the causes of the primary optic neuropathy are AION, anterior ischemic optic neuropathy, trauma, tumor, toxins, or drugs may also cause the primary optic atrophy and the autoimmune disorder like multiple sclerosis and degeneration. Congenital causes, Leber atrophy, and autosomal dominant, they may cause primary optic atrophy. Now, chemicals and drugs that cause optic atrophy are ACDE2M. A for amiodarone, C for ciprofloxacin, D for digitalis, E for ethambutol or ethylene glycol, and methanol. Methanol and ethylene glycol cause acute blindness, acute optic atrophy, and ethambutol causes slow, progressive, bilateral, gradual visual loss. So let's discuss methanol. We already discussed its toxic metabolite is formic acid and formaldehyde and causes bilateral blindness. Whereas ethylene glycol, it's used as an antifreeze and causes cerebral edema with bilateral visual loss acutely. Its toxic metabolite is glycolic acid, and the treatment is same as that of methanol, that is ethanol and a fompazole. So this is the comparison between the three substances and their end product. Ethanol produces acetyl-CoA, methanol produces toxic formic acid and formaldehyde, and ethylene glycol produces glycolic acid, which is converted into glyoxylic acid. So it's a funny question here. What's the difference between ethylene glycol and polyethylene glycol 3350? Polyethylene glycol is a laxative. It's not absorbed. It causes osmotic effects on the intestine, producing stools. Then the ethanol toxicity. Ethanol is an anti-tubercular drug used, and it's toxic for the retinal ganglion cell layers, and it causes bilateral visual loss with secocentral or central scotomas because this is toxic thinning of the retinal nerve fiber layers, RNFL. So the toxicity is reversible, but it may be permanent. So discontinuation of the drug should be done, and this toxicity occurs about 3 months after the starting the treatment, and the eye examination is recommended every 3 months. And which vitamin is effective in preventing it? That's vitamin B6, pyridoxine phosphate, prevents. And the next drug is amiodarone that is deposited in the cornea. And then tobacco also causes slowly progressive, painless visual loss bilaterally. Then we have anterograde optic atrophy or Valerian degeneration. In this anterograde degeneration, there is degeneration from retina to the lateral geniculate body. The other one is retrograde degeneration, is proximal portion of the axon to the optic disc. Then we have glaucomatous optic atrophy. It has some changes of both. Serous margins are clear and cupping occurs superiorly here. More, and the blood vessels, there is what is called the nasalization of blood vessels. So features of that of the papilledema, but otherwise the margins are very clear and there is backward bowing of lamina cribrosa.